What is varicose veins? Causes, symptoms and treatment explained in 2 minutes. Varicose veins are enlarged, swollen and twisted veins, most commonly seen on the legs and feet. They occur when the valves in your veins become weak or damaged, causing blood to pool instead of flowing smoothly back to the heart. They appear as blue or dark purple veins that bulge or twist under the skin, often like ropes or cords. Swelling around ankles, itching or skin discoloration, pain that worsens after standing for long periods. Varicose veins are more common in women, people over 40, those with sedentary lifestyles, pregnant women, people with a family history of vein problems. While often considered a cosmetic issue, untreated varicose veins can lead to pain, ulcers, skin changes, and even blood clots. Mild cases can be managed with compression stockings, regular exercise, leg elevation. For advanced cases, minimally invasive treatments like laser therapy, radiofrequency ablation or sclerotherapy are highly effective, all available at Healing Hands Clinic. For expert consultation, call us at 8888 88884. Follow us on Instagram, Facebook and YouTube at Healing Hands Clinic. Stay informed, stay healthy.